Hey there, it's Heidi here from the First Aid Nest. I hope you're well. In this video, we're going to talk about CPR in a baby. Okay, so a baby, what we're talking about here is an infant, which is any child that's under 12 months old. Okay, so this is quite close to my heart because I am a registered paediatric nurse and have been for 22 years now. I'm also a clinical nurse specialist in childhood allergies. So pediatrics is my thing, babies are my speciality. So I will talk you through now how to do CPR on a baby because it is quite different to an adult. The other thing about babies is that they don't often, they can't tell us what's wrong. They can't communicate very well. They're often just either very irritable before something catastrophic happens, like them needing to have CPR for some reason. A respiratory arrest is relatively common in babies. A cardiac arrest, not so much. But if a baby stops breathing, or if anyone stops breathing, we go straight into CPR. Okay, so we can say that it is, when a baby stops breathing, which some babies just do for various different reasons, illnesses, or sometimes unfortunately it just happens, then we would go straight into CPR if they stop breathing. Okay, but babies can be quite unpredictable and they can go downhill very, very quickly. So even any child under 3 months, that has a fever of 38 and above has to be rushed into hospital for investigations because their little bodies just can't handle severe infection when it kicks in really, really quickly. So that's just an example of how tricky and how fast you need to act with a small child. So with a baby, the differences are the head position. Okay, so when we are doing CPR on a child, we have to remember that under 12 months, their airway is like a plastic straw. And if you kink it, it's going to kink properly. It's going to actually block off a bit, okay, which is why people are so worried when you have a newborn. It's always like, watch the head, because you don't want them too far back or too far forward, okay? So with a baby, we want their head to be in what we call the neutral position. With an older child or an adult, we want them in the sniffing position, which helps to open their airway. But with an infant under 12 months, we want them just in the neutral position. So just facing straight forward or straight up. Obviously, they'll be laying down. So that's the first thing. Now, when we're checking for the breathing, we have to take into account that the baby normally breathes a lot faster than an adult. But if they're not breathing normally and it's very laboured or very, very shallow, then we still take that as not breathing normally and we would still start CPR. It's very difficult to give exact examples of a baby not breathing normally. But if the breathing is very shallow or they're not breathing normally, a child under 12 months normally changes colour. At least around the lips, they can look a little bit blue. And it's normally a lot more obvious than it is in an older child or an adult. So what we're going to do is, with the head in the neutral position, we would start CPR. And what we start with is the compressions, and then we go to the rescue breaths. So with the compressions, for a child under 1 year, most of the time we're going to use 2 fingers. And we're going to use them in the middle of the nipples, so in the centre of the chest, in between the nipples, and facing to the side of the body. So we're not facing up the way, like with a choking, we would have the fingers facing up the way. With CPR, we have the fingers facing on the side, okay, and between the nipples. What we're going to do is 30 compressions, 2 per second, and about 1/3 of the depth of the chest, which is around about 3 to 4 centimetres, okay? It's a very, you can't measure that, obviously, but it's just a rough idea for you. So around about 1/3 of the chest. Now, please don't worry about hurting or breaking the baby. This has to be done if they're not breathing properly, but also babies' bones under the age of 18 months are very pliable. They're like cartilage. They're very, very bendy. So it's very hard to break a baby's bone, okay? Especially the ribs. They're very, very bouncy. So it's much more common in adult CPR to break ribs and break bones, not so much in babies, okay? So plus this just has to be done. So 30 compressions with 2 fingers. Now, if you have really small fingers and the baby is a big, 12-month-old bruiser, then that may be really sore and you may not be able to get enough momentum to be able to do the compressions properly. So you can use just the heel of one hand, but just remember that you're a lot stronger with one hand than you were with 2 fingers. So making sure we're not going too deep, making sure we're just doing 1/3 of the depth, okay? Then we get to rescue breaths. Now, the guidelines say that we only need to do the rescue breaths if we're willing, able and trained. If it's your child, you're probably still just going to go ahead and give them a go anyway. But if you cannot or do not want to give rescue breaths, then just continue with the compressions, continuous, until help arrives. Because remember, by the time we get to do CPR, we've already called an ambulance. It is already on the way, okay? Once you start CPR, you don't want to have to stop. So with a very small baby, you can get your mouth around the mouth and nose, because we don't want any air to be flying out anywhere else. We need the air to be going down into the lungs. We want to give just the contents of our cheeks, really, as just blowing in like 1 to 2 seconds. Remember, the lungs are very small. We want to just see some chest rise. We may not, if there's a big blockage in the throat, we may not see chest rise, but we can still try. You don't need to worry about the blockage being pushed further down by your breath, because it's just not going to be that powerful, okay? So we can try with the rescue breaths. Now, it's not always easy to get your mouth around a mouth and nose with a slightly larger baby. So if you can't get a good seal, pinch the nose and then just get a good seal around the baby's mouth, okay? But remember to pinch the nose, otherwise your air that you're blowing in will just come out the nose and it's not going anywhere, it's not doing anything, all right? It is, at the end of the day, still secondhand air. The compressions are really important because the body already has oxygenated blood in there. So all we're trying to do with the compressions is keep that oxygenated blood going around the important parts like the brain and the organs, okay? But if you can do rescue breaths, great. So we're going to do 30 rescue breaths to 2 compressions, and you just keep going. Compressions with your fingers, if you have to, using one hand, but just keep going, okay? Keep going until the baby recovers, help arrives, or you become physically exhausted, okay? They're the 3 reasons to stop CPR on a baby. So I hope that's helpful today. If you've got any questions at all, just drop us a line. You can email us or go to the website or just drop some comments below. Okay, thank you. Bye-bye.